Okay, guys, we are going to start our lecture on psychological therapies. So um, let's go ahead and get started. We will talk about all the different kinds of therapies that you would need to know for the AP exam. This isn't all of them, but these are the ones that are probably the most important to know. First of all, psychotherapy is, like it says here, an interaction between a trained therapist and someone suffering from psychological difficulties. And this can be anybody that, from any of the different theories can do psychotherapy, and there's just several different types of psychotherapy. So let's get into looking at the various types of psychotherapy. Here's just some definitions. Psychotherapy involving an emotionally charged, confiding interaction between a trained therapist and a mental patient. Then there's biomedical therapy, which uses drugs to work on the chemicals in the brain, the nervous system, which can help them with psychological disorders. And then there's an eclectic approach, which uses a combination of the two. And this is what is most common in psychotherapy today in working with any kind of people with psychological disorders. Most often it's a combination between some sort of talk therapy and a biomedical therapy, just working in conjunction with each other. The psychological therapies that we'll talk about are psychoanalytical, which is Freud, humanistic, which is Rogers. Carl Rogers is kind of the main guy for that. And then we'll talk about some behavioral therapy and cognitive therapy. So some of these you have probably already heard of and will be familiar with. So it should help you in this chapter. Let's start with the eclectic approach, because pretty much 90%, I would say, of therapists nowadays use an eclectic approach. It is just where we combine techniques of different schools of psychology. We work with what is going to work best with that with the particular client that you're working with. If a behavioral approach would work best, we'll do that. If a cognitive approach will work best, that's what we'll do. We just do what is best for the client, and that is called an eclectic approach, when you use a bunch of different therapies, combining them to do what is best for the client. All right, psychoanalysis is Sigmund Freud's therapy. As you should already know, Freud used free association, hypnosis, and dream interpretation to get insight into clients' unconsciousness. He'd just have them sit on his couch, and they would talk. They would use free association, which is just talking without editing yourself. And hopefully through doing that, they would get to what is underneath, into the unconscious. Freud would also use hypnosis, and he would interpret dreams. Again, you should already know he would look at the manifest content and the latent content of dreams. The manifest content being the storyline of the dream, and the latent content being the underlying meaning of the dreams. And he would analyze these to find underlying meanings for what the patient was going through, and help bring the unconsciousness into the conscious so that they can become aware of it and change whatever difficulties they were having. Psychoanalysis, as kind of what I just said, looks at problems that typically originate from childhood repression, and the aim of psychoanalysis is to bring the repressed feelings into the conscious awareness so the patient can deal with them. When energy that's devoted to the id, ego, and superego conflicts are released, the patient's anxiety lessens. And if you'll remember, we talked about the id, ego, and superego in a previous chapter, where the id is kind of the animalistic desires. The superego is kind of the ideal perfectionist, and the ego balances the two out, and so they're in conflict with each other. And when that conflict is released, a patient feels less anxious. Again, I've already talked about free association, where you'd lay on a couch and just talk about whatever comes to your mind without editing yourself. It's harder to do than you might think, because we're so used to editing our thoughts and filtering our thoughts. And one of the things that Freud would do would be to get patients to be able to not filter themselves, so that he could really see what was in the unconsciousness. This is just more talking about free association, and when the patient has trouble free associating, Freud would call this resistance, and he would have them talk about the resistance that they're feeling. Why is the patient resisting talking about a certain thing? Why are they avoiding certain topics? He was really all about talking about their resistance to talking about things, because that's where the good stuff was, according to Freud. That's where the stuff was that they needed to talk about. Transference is a psychoanalytic term. This is where the patient transfers emotions that they have to the analyst, to the psychoanalyst, emotions that they have for another person. And again, we've talked about this, so this should not be anything new for you. Now, there's a term called countertransference, where the therapist has feelings back towards the client. That is not good. The transference is good, because that's something that the therapist can work with, but the therapist does not need to have those feelings back towards the patient. Countertransference is basically just unethical. Some criticisms of psychoanalysis. It's hard to refute, because it can't be proven or disproven. It takes a long time, and it's very expensive. People will be in psychoanalysis for years. In fact, for someone to actually be a licensed psychoanalyst in Freud's techniques, they have to go through psychoanalysis themselves and be in it for like 7 years. So it's very lengthy. There's not a lot of science that really backs it up. But it is it's one of the first psychotherapies, so that's kind of what makes it significant. And that's what a lot of other therapies were built off of. All right, humanistic therapy. This is our friend Carl Rogers. Focuses on people's potential for self-fulfillment, what we call self-actualization. If you remember, Maslow is also a humanist. It focuses on the present, not the future, and not the past, and focuses on conscious thoughts, not unconscious ones. They want you to take responsibility for your actions instead of blaming childhood anxieties. So this is the therapy attached to the humanistic theory. So the most widely used humanistic technique is client-centered or person-centered therapy. Carl Rogers, his big thing is being very real, being very genuine, and showing empathy to people, and what he called unconditional positive regard. He really wanted to let people know that he cared. And this isn't a pretending to care type of thing. A person truly doing client-centered therapy really does care. They're someone that can find the good in almost anyone. Now, this Mr. Rogers is not Carl Rogers. This is Fred Rogers from the children's TV show Mr. Rogers. But he was very much a humanist as well. Someone that could um, find the good in pretty much anyone. And that's the kind of mindset that a humanist needs to have, a humanistic therapist needs to have. One of their techniques is called active listening, where they will kind of repeat back what the person says. They'll restate what they say or clarify what they say, just to make sure that the client knows that you're listening. If they say, "Oh, I'm feeling very sad today. I'm really upset about something that my mom said to me," the therapist might say, "So you're feeling upset today? I hear that your mom upset you. Tell me more about that." So they're just kind of repeating things back to let you know that they're there with you. Behavior therapies. This is therapies that apply learning principles to the elimination of unwanted behaviors. They don't. Behavior therapists don't really care about underlying problems. They just deal with the behaviors. The behaviors are the problems, so you have to change the behavior, not all the other, what happened with your mother and what happened in your childhood type of stuff. They're only focused on the behavior. So you can use classical conditioning in this. Part of that is counter conditioning. And counter conditioning is just a therapy that conditions new responses to stimuli that trigger unwanted behavior. So there's two types of counter conditioning. One is exposure therapy, and the other is hold on. One is exposure therapy, and the other is aversive conditioning. So let's talk a little bit about both of those. Exposure therapy is exposing patients to the fear that they have and fear that they try to avoid. And they'll repeatedly expose them to it, and the more they get exposed to it, the more their anxiety begins to lessen because they become habituated to it. So it's really making people face their fear. And they'll do it just a little bit at a time until they get used to it. And eventually their fear will go away. They've also started to use virtual reality in exposure therapy, just bringing technology into it, helping people overcome things like flying. They've also used it to help treat post-traumatic stress disorder, putting veterans back in virtual war situations and letting them employ relaxation techniques to go along with the exposure therapy. It's proved to be quite effective. Now, one part of exposure therapy is systematic desensitization, where you're exposing them to the unpleasant thing gradually. So here, the dude looks at a small spider, then a bigger spider, then a bigger spider, and now he's about to get eaten by one. So here's kind of what we'd look at with systematic desensitization. We'd have, here's a little girl, she's scared of a spider. We'd have her first start looking at a picture of a spider, then maybe touching the picture, then looking at a toy spider, and then maybe holding the toy spider, then holding a dead spider, or even looking at a dead spider, eventually holding a dead spider, then finally have her holding a live spider. This takes time, but you see definite results as you go through it. And you just keep repeating the behavior until the anxiety goes down. So It's an exposure therapy, but it's done in a very systemized way, and it's called systematic desensitization. So, what you might think is, how could I use systematic desensitization to reduce my fear of old women? Now, I'm not really afraid of old women, but just as an example, think about that. How would you use, if I came to you and said, I'm afraid of old women, how would you use that to calm my fear? So think about that, and then you're employing systematic desensitization. Aversive conditioning is just a type of counter conditioning where you associate an unpleasant state with an unwanted behavior. For instance, you're chewing your nails. Not supposed to chew your nails. So what am I going to do? I'm going to associate poop with chewing your nails. So if I put poop on your fingernails, you'd probably stop biting them. Now that's an extreme example, obviously, but they do have things for nail biters where they put like a little medicine on their fingernails, a little liquid, and it tastes very bitter. And so little kids put their hands in their mouth, and it tastes nasty, so they take them away. So that's aversive conditioning. And you can see this is just a classical conditioning technique where you have the unconditioned stimulus, unconditioned response, and this is with alcohol. Unconditioned stimulus is a drug. Unconditioned response is you get nauseous. You put that unconditioned stimulus with the alcohol, and then you start feeling nauseous. So then you start relating alcohol to the unconditioned response. So and now you have a conditioned response with the alcohol. So we talked about this classical conditioning earlier in the year. Think of food poisoning. You eat something that you don't like, you get sick, you don't want to eat that again. Simple classical conditioning. So another thing to think about, what are some of the ways that you could change some of the behaviors of your friends with aversive conditioning? So start trying to think of ways that you could use your knowledge for good and or evil now. Just kidding. All right. Operant conditioning. Token economy. This is a procedure where we reward desired behavior. This is used a lot in mental hospitals. It's even used in prisons, where you do something that you're supposed to do, then you get some sort of token. It could be a plastic chip. It could be anything. But you save up enough of them, and then you can exchange it for something that you want. Like in a mental hospital, a lot of times they'll be able to exchange their tokens for. A lot of times they like to smoke, so for smoke breaks. If you were ever in in the lower school and had a teacher that put stars up on the board, and if you got so many stars, then you could get a prize. They were using a token economy. The token themselves don't have any value, but you can exchange it for something that is of value. So token economy, same thing as stars on the board. The next thing we have is cognitive therapy. I'm going to talk about this in the next video, as this one's gotten pretty long. So I'm going to stop here, and we'll pick up with cognitive therapy in just a minute.